Welcome, and thanks for joining this lecture on NPUs, the silent engine powering medical AI at the point of care. In the next slides, we'll explore how dedicated neural processing units transform devices from imaging systems to bedside monitors, delivering efficient, reliable AI where latency, privacy, and power really matter, and why that matters for clinicians and patients alike. This slide breaks down the silicon advantage of NPUs, showing a systolic array paired with on-chip SRAM to keep weights local and latency low. The diagrams highlight how NPUs deliver 10 to 100 times better ops per watt than general-purpose chips, with deterministic latency and milliwatt power budgets that make real-time, bedside AI both feasible and energy efficient. Here we look inside an imaging gantry, where an embedded 40U TOPS NPU enables denoising, super resolution, and segmentation directly on the scanner. The visual explains sub-30-second flagging while the patient is still in the room, cutting transport delays and easing radiologist overload by providing instant, reliable findings before the patient ever leaves the scanner. This slide shows probe-to-decision handheld ultrasound enabled by a 6-watt SMARC module with an integrated NPU. The NPU streams 1080p probe data, classifies ejection fraction and pleural effusion on the fly, and overlays measurements on the clinician's tablet, avoiding cloud round trips so clinicians get immediate, actionable results from a single handheld device. The NPU Accelerated Vision Kit for endoscopic towers is designed for real-time surgical precision, with modules for depth estimation, instrument tracking, and automated bleed detection. The graphic emphasizes zero-lag augmented overlays under 1 millisecond and 2.3 TOPS performance, helping surgeons maintain spatial awareness and react instantly to critical events during procedures. This illustration shows how NPUs can make defibrillators smarter by analyzing impedance and ECG morphology in real time to auto-adjust shock delivery. The on-device analysis turns bystanders into effective responders, optimizes standby power to meet IEC 60601 requirements, and keeps the device ready for immediate use while preserving battery life and safety compliance. The chest patch concept combines local data acquisition of PPG, respiration, and motion with a sub-half 5 milliwatts NPU that fuses signals to forecast sepsis or COPD exacerbations hours ahead. The flowchart highlights anonymized risk score transmission to preserve privacy, extended battery life, and tangible clinical benefits, like fewer ICU admissions thanks to early, patient-specific warnings. Smart hospital beds use NPUs to learn mobility patterns and build personalized mobility profiles, then apply real-time adjustments to bed tilt and mattress pressure to prevent pressure ulcers. The slide also shows offline, on-device speech recognition for nurse calls that preserves HIPAA privacy, illustrating how local inference enables proactive, personalized, and private patient care at the bedside. This slide describes edge NPUs powering patient-specific digital twins, where models generated in the cloud are securely transferred for zero-latency bedside inference. The diagram emphasizes immediate simulation results for clinician-driven planning, stronger privacy since data stays local, and faster workflows that streamline consent and therapy planning with real-time bedside feedback. Here we see an NPU-enhanced vaporizer controller that continuously predicts MAC and adjusts anesthetic delivery second by second, using end tidal gas and vital signs. The schematic makes clear how tighter depth of anesthesia control reduces manual titration and leads to fewer adverse events, turning continuous on-device inference into a safety and precision tool in the operating room. This regulatory overview maps how locked-down NPU weights can be accepted in SAMD submissions along both 510Ks and de novo pathways, with traceability and drift monitoring. The diagram calls out predicate device examples and explains how documented datasets and ongoing drift reporting establish safety and enable FDA review and clearance while preserving regulatory confidence in on-chip inference. The comparative analysis on this slide highlights why optimizing for thermal headroom and deterministic latency matters in clinical environments. like a 40 degrees Celsius ambulance cabinet. It shows that sustained 45 TOPS NPUs can outperform higher FT-ops GPUs that throttle under heat, delivering reliable latency at load and predictable response times essential for real-world medical devices. This slide outlines a rapid path from concept to field test by combining medical-grade BSPs and pre-certified kernels with off-the-shelf daughterboards for cameras, sensors, and safety MCUs. The flow stresses rapid prototyping and integration to enable hospital R&D teams to validate NPU algorithms clinically in roughly 4 weeks, accelerating iteration and deployment in real settings. Looking ahead, the future vision pairs sub-8 milliwatt NPUs and wireless power harvesting with ingestible capsules, real-time video biopsy, and on-the-edge learning to enable closed-loop patient AI. The final graphic ties these ideas together into intelligent feedback systems that personalize monitoring and therapy, suggesting the same NPU architecture can extend care from the ICU to the intestine.